Ethiopia sits at the intersection of a complex range of economic, climatic, and social factors that continue to drive human mobility within and across its borders. The year 2020 was a particularly difficult one for Ethiopia and indeed for the global community. In the context of Ethiopia, we saw a difficult context become even more multi-layered. We saw a health pandemic and a political crisis add to fuel ever larger movements of people within and across Ethiopia's borders. In 2020 alone, we saw over 60,000 Ethiopians returned and or deported in the context of a pandemic. Such a large movement of people in a global health pandemic context compelled us to work closely with partners and of course with the government to ensure that these movements were managed in a manner that ensures the safety and the dignity of these returnees, but equally importantly, that they were assisted to sustainably reintegrate into their lives so as not to further fuel re-emigration. It's also important to point out that it isn't sufficient to give that individual migrant the wherewithal he or she needs to sustainably reintegrate into their lives and communities. It's important that the communities that receive these migrants are also given the support that they need in order not to create disparities, but also in order not to incentivize irregular migration. In the context of COVID, we also worked closely with the government of Ethiopia, as we continue to do, to ensure that there is the necessary surveillance at points of entry for COVID-19 so as to track the movement of the virus, undertake the needed preventive action to avoid exacerbating the spread of the virus through these human mobility instances. So against this complex backdrop that I have just described, IOM continues to work assiduously with the government of Ethiopia and other relevant partners to do three things. One is to work to save lives, address protection needs, and reduce suffering through urgent humanitarian responses. Second is to address the long-term drivers of irregular migration from Ethiopia. And then third, but not least, would be the need to strengthen preparedness and reduce the risk of disaster. To this effect, IOM Ethiopia seeks funding to the tune of 110 million, which we estimate will help more than 1.7 million Ethiopians in urgent need of support. I would be remiss in not using this opportunity to thank the international community for their continued assistance to Ethiopians in need. And I hope that this urgent situation Ethiopia faces at this point in time will meet with the same generosity that we have seen characterize previous donor funding for populations in need in Ethiopia.